very common. People come in who've had orthodontics before and they've noticed a little shifting of their teeth. And most people are surprised that their problem can be corrected relatively easily in a very short amount of time using something that they can take in and out of their mouth or with a few braces just for a very short amount of time. Most people are expecting it's going to take much longer than it actually does for a touch-up. And the treatment really depends on what the patient wants. So the first question the doctor should always ask is, what are you here for? What would you like me to do for you? And if they're looking for full treatment, they can certainly say that, but if they're looking to have something touched up where they've had some minor movement, they should say that too. And the doctor really needs to try and get the treatment to what the patient not only needs, but what they want. Now, the most common problem is the lower teeth getting crooked over time. That seems to be the hardest thing for orthodontists to maintain, no matter who the orthodontist is. And so a lot of people will come in and they'll need a touch-up on their bottom teeth. And a lot of people will think that means they have to have it on their upper teeth as well, but usually they don't. The little tiny spaces in the upper teeth is also a very common thing. And so we make lots of little removable retainers that will correct that very easily. And the nice thing is you'll have the appliance and you can use it as you need it, right? If you miss it for a week or two and the gap comes back a little bit, you can put it back in and it'll treat your problem. So many things can be done very easily for problems like that. I'd say the number one cause of it is that most people, especially men, will grow a little bit after they've had their braces. And if your lower jaw grows a little bit more than your upper jaw, your lower teeth will need to fit inside your upper teeth. And so sometimes they will tip back and bunch up so that your bite is maintained normally. The same problem will cause your upper teeth to space. If your lower jaw grows more than your upper, when you bite down, it might push your upper teeth open a little bit. Orthodontics is really unique in that really the people who get orthodontic treatment are the people who want it. I mean, there are many people that have crooked teeth that don't really care about it or don't want to get them straightened, so there really isn't any must-have treatments. Now, there are patients who come in that I'll really suggest to them that this would benefit them tremendously to have their problems corrected. And on certain kids, there are things that I'll really push for the parents to do. But for the most part, people who need orthodontics are the people who want it.